nandiyan pala kayo. So, kamusta na kayo? Matagal-tagal na tayo hindi nagkikita. So, mamaya, abangan nyo, may mga sasabihin ako at about to sa pharmacology. Sana may matutunan kayo. Hey! So, I'm back! So, ito na nga, yung pag-uusapan natin ngayon is yung about sa pharmacology. So, yung topic na napunta sa akin is yung drugs affecting the urinary tract and bladder. So, sana may matutunan kayo sa ating pag-uusapan. So, ito na, bladder. So, una is urinary tract infections, bladder spasms, bladder pain, and benign prostatic hyperplasia are the common problems that affecting the urinary tract and bladder. So, yun yung mga problema o mga disease na nakakaapekto sa ating urinary tract or bladder na maaari ring makasira sa ating urinary tract and bladder. So, una is urinary tract infection. So, urinary tract infection is, alam nyo naman yan, common yan. Lalo na sa mga bata. Sa mga bata is madalas magka-UTI dahil nga, prone sila sa mga bacteria. Especially sa women. Sa women, bakit? Kasi yung mga women may mga shorter urethra lang yan. Tapos, yung patients with indwelling catheters or intermittent catheterizations often develop bladder infections or cystitis. So, kasi, kapag yung catheter, kahit nasabihin mo sterile yan, kapag pinasok yun sa bladder, maaari rin kasi mag-iwan yun ng magdala ng bacteria sa bladder at saka sa urinary tract. Tapos yun, kapag nag-blockage siya, pwede siya maging pyelonephritis o yung inflammation of the pelvis of the kidney natin. So, kasi pag nag-backflow yun, mas lalala yung bacteria as mag-grow pa siya. So, yun, yung sign and symptoms of UTI is yung frequent urination, and burning on urination, chills, fever, flank pain, and tenderness. Tapos, yung mga clinicians ay nag-invento o gumawa ng mga anti-infectives at meron yung dalawang klaseng ginawa sila para sa UTI. Yung isa is yung antibiotic na makakasira o makaka-invade ng bacteria, and yung isa is na anti-infective is yung makakapag-acidify ng urine para mawala yung mga bacteria. Tapos, itong dalawang anti-infectives nito is yung gagamitin para ma-sterile yung bladder or yung urinary tract para mawala ma-invade yung bacterial growth. So, yun nga. Drug that blocks spasm of the urinary tract muscles, decrease urinary tract pain, protect the cells of the bladder from irritation, and treat enlargement of the prostate gland. So, yung antibiotics or yung drug choice na nakaka-treat ng UTI is sinosaxin, norfloxacin, fosfomycin, nalidic acid, and nitrofurantoin. So, sinosaxin is rapidly absorbed, interferes with DNA's replication in gram-negative bacteria. So, norfloxacin, effective against even more gram-negative strains than in sinosaxin. So, next natin yung fosfomycin. Yun, one dose convenience lang yun. Tapos next is yung nalidic acid. Yun yung older drug o yung first drug na na-invento para makatreat sa UTI. Pero, hindi na siya ganun ka-effective sa gram-negative bacteria. Tapos yung nitrofurantoin is meron lang siyang short life. So, hindi siya magtatagal. Baka hindi makatreat. Tapos yung anti-infectives naman na nakaka-acidify ng urine is yung methanamine and methylene blue. Yung methanamine is pwede siya sa bata and meron siyang suspension form. Tapos yung methylene blue is metabolized in the tissue and excreted in urine and bile and feces. So, yung urinary tract antibiotic acts specifically within urinary tract to destroy bacteria either through direct antibiotic. Ayun nga, yung sinabi ko kanina. Yun yung therapeutic action niya. Tapos yung contraindication ng dalawang anti-infectives na yun is yung contraindicated in the presence of any known allergy to any of these drugs to prevent hypersensitivity reactions. Yun yung precaution niya is yung presence of renal dysfunction which could interfere with the excretion and action of this drug. Adverse effects niya, syempre yung mas common is nausea, vomiting, diarrhea, anorexia, bladder irritation, and dysuria, pruritus, urticaria, headache, dizziness, nervousness, and confusion. So, yung next is urinary tract antispasmodics. Ito yung antispasmodics is yung binablock niya spasm of urinary tract muscles. So, indication is treat bladder spasms and dysuria or yung pain nga in urination. Tapos, drug of choice is darifenacin, fluvoxate, solifenacin, oxybutynin, toletidine, and trospium. So, yung pharmacokinetics niyan is yung treatment for overactive bladder in patients with urinary urgency, incontinence, or frequency. Or, yun nga, frequency. Tapos, in contraindication niya is allergy, pyloric or duodenal obstruction, recent surgery, urinary tract problems, glaucoma, myasthenia gravis, or acute hemorrhage. Caution niya na naman is yung renal or hepatic dysfunction. Yung adverse effect niya is yun nga, related to sa parasympathetic system. So yung next is yung urinary tract analgesia. So pag sinabing analgesia, ito yung gagamitin para maka-treat o ma-decrease yung pain. So yung isa lang yung drug of choice natin dyan, and yun yung phenazopyridine. Yung indication nun is yun nga, to relieve bladder pain or discomfort. Tapos yung action niya, kapag yung when phenazopyridine is excreted in urine, it exerts as direct topical analgesic effect on the urinary mucosa. So yung pharmacokinetics niya is rapidly absorbed and has very rapid onset of action, widely distributed and metabolized in liver and excreted in urine. So yung contraindication niya is allergy and renal dysfunction. Tapos yung caution niya, pregnancy and lactation. Bawal siya sa buntis, maraming maka-apekto sa fetus. Adverse effect niya is GI upset, headache, rash, reddish-orange coloring of the urine, renal and hepatic toxicity. Drug-to-drug interaction, pwede mo siyang igamit with antibacterial agents. So next yung bladder protectants, used to prevent irritation to the bladder wall. So yung drug of choice natin dyan is lang, pentosan polysulfate sodium. Indication niyan is bladder pain and interstitial cystitis. Yung action niya is heparin-like compound that has anticoagulant and fibrinolytic effects. Adheres to the bladder wall mucosa membrane and acts as a buffer control to control cell permeability. Tapos para pag na-reach niya, tapos marireach niya yung urine, tapos mapunta sa bladder wall. Tapos yung pharmacokinetics niya is very little of the drug is absorbed. Kasi nga, yun, tinake mo na siya, yun, may excrete na dun yun. Metabolized in the liver and spleen and excreted in the urine. Tapos yung contraindication niya is yung maaari ka magkaroon ng bleeding or heparin-induced thrombocytopenia. Caution niya is hepatic or splenic dysfunction, pregnancy or lactation. Adverse effect niya nga, bleeding that may progress hemorrhage, yung may headache and disturbances. Tapos next naman natin is yung treatment for benign prostatic hyperplasia. Yung hyperplasia is, tinatawag din siya prostatic hypertrophy or enlarged prostate. Ang nangyayari doon is yung na-encircle yung urethra ng prostate. There are two types of drug to relieve symptoms of BPH. Yung una is yung alpha-adrenergic blockers and drugs that block testosterone production. So yung alpha-adrenergic blockers drug is yung napili natin is yung alpozosin, doxazosine, tamsulosin, terazosin. Indication niya is to relieve symptoms and treatment of BPH and hypertension. Tapos yung drug na itong pili na drug of choice naman natin sa nagbablock ng testosterone production is yung dutasteride, finasteride. Yung dalawa na yon. So siya is long-term treatment siya sa symptomatic ng prostatic hyperplasia. Yun nga para ma-relieve yung symptoms nun and ma-prevent yung male pattern baldness. So contraindication is allergy, caution is hepatic or renal dysfunction, adverse effect nun is headache, fatigue, dizziness, postural dizziness, Letter G, tachycardia, hypotension, GI abscess. Siyempre, yun, dahil nga ang prostate yung inaano natin is nadi-decrease na yung libido at pwede din impotence at saka, siyempre, sexual dysfunction. Yung pwede mo siyang ihalos, pag i-take kasama yung theophylline. So, yun. Sa lahat naman nito is ang kailangan natin, ang nursing consideration natin dito is syempre yung advice. So, yun naman laging pinakamahalaga, lalong-lalo na kapag magbibigay tayo ng gamot sa ating mga patient. So, yun yung assess, kailangan natin mag-assess, mag-monitor, check, tas yun, kailangan, syempre importante, document lagi. So, yun. So, sana may natutunan kayo. So, yun lang naman yun. Tas, ayun, so, thank you guys sa paglaan ng time. So, sana may natutunan kayo. Tapos, huwag nyo syempre kakalimutan, subscribe nyo na itong channel ko, tsaka, and hit the bell button below. So, mali nyo pag kumita ako, may pabigay ako, may pag-giveaway ako. So, bye-bye! Thank you!
Mayor!